the dangers of obesity. We talked about some of them. We've got a few more dangers to talk about. Now, in men, if your waist measurement is 40 inches or greater, you're at a much greater risk of high heart disease, high blood pressure, stroke, and sleep apnea. Women, if your waist measurement is greater than 35 inches, you're also at a much greater risk of heart disease.
Welcome to Dr. Colbert's Divine Health broadcast. I'm Mary Colbert, and you know, Don is going to be talking about a topic that you probably have heard him talk about before. You know, he is always looking to get the newest, bestest, most accurate information.
Not bestest.
Bestest. Oh, it's the bestest. That's my language. Anyway, so Don, you know, I'm going to have to listen real close because this affects me.
You've been breaking all the rules of this, Mary.
You know, the thing is, I knew this topic was coming, so I just felt the Lord kind of say, now, Mary, you know, you go back and, you know, 300 or 400 years, you look at the women, they weren't skinny. They were round. They were very round. You know how I know that? Looking at the statues and the paintings of the women and stuff. So,
Yeah.
you know, part of, you know, our biological body as we get older, you know, some things just don't stay thin and tight. But
Well,
here we are, belly fat. We're going to talk
Exactly.
about belly fat.
Exactly. And again, so many people get offended with the word obesity. And in medicine, we had a term called morbid obesity. And they would really get offended when you say, oh, you have morbid obesity.
Isn't that hilarious to me?
Morbid obesity means the obesity is related to a disease you have.
Well, doctors
Diabetes.
don't say that anymore.
No, now it's class 1 obesity,
Yeah.
which is a BMI of 30 to 34.9. Then there's class 2 obesity, makes them where they're happier. They don't get
They don't feel so
angry.
convicted.
Class 2 is a BMI of 35 to 39.9. And then class 3, which is morbid obesity,
Yeah.
is a BMI of 40 or higher. Can you believe?
You know, it's so funny. I heard you tell stories of patients that would come in and you'd say to them, so, no, you're morbid obese.
I can't say that anymore.
And the patient would look up at you and go, Dr. Colbert, did
I'm
you
insulted.
tell me that I'm morbid obese? Little to say they never came back. Sir, you know, so now they've changed it so that
Class 1,
now,
class 3.
you're class one.
Class 3. Oh, I'm a class 3. Does that mean I'm better? No.
Does that first class?
No, that means you're in trouble. Okay. But Mary, you know the average waist measurement of a woman, an average American woman?
Gee,
You know what it is?
35, 36? Oh, gee. Women and men?
This is just women.
Just women?
Yeah.
More than 36?
38.7 inches around the belly button, navel.
No, not for women?
For women. You
That's
know
average?
the waist of a man, average man's waist?
Oh, my Lord.
Think.
Okay.
What would you say?
I guess we're going to have to go to the 40s.
40.5 to 42 inches.
42?
40.5 to 42. That right in that gap is where most men's waist measure. Now, again, when you choose to have a waist measurement that large, you have just signed up for almost every disease, including diabetes, pre-diabetes, high blood pressure, sleep apnea, increased risk of stroke and heart attack, and fatty liver. And all of these diseases, comorbidities, come with that belly fat. See, belly fat is the most toxic fat in the body. It releases these powerful cytokines or inflammatory mediators. One is called C-reactive protein. C-reactive protein causes your arteries to constrict, so it raises your blood pressure. It also produces tumor necrosis alpha, causes chronic inflammation in the body, which is the root of most every chronic disease. And it also releases this interleukin-6, another cytokine triggering chronic inflammation. So no wonder we have all these inflammatory issues that so many people face. Most all chronic diseases have at its root chronic inflammation. But going back to belly fat, you know what the main trigger of belly fat is?
Sugar.
Sugar and highly processed carbohydrates.
Yep.
Sugar. Now, America's addicted to sugar. On average, we eat about an equivalent of 100 pounds of sugar per person per year. That's a lot of sugar. And sugar's in, what, everything that has sugar, most people do.
Mhm.
And people continue to eat it because it tastes good. I have patients that come to see me after Christmas, and they say, I cannot believe I had my blood work now because my sugar's high, my cholesterol's high, my triglycerides are high, I got fatty liver, I got all these problems I didn't have before the holidays. And they're angry at me. And I said, you did it. You ate the food. And they said, yes, but it tastes so good. I had pumpkin pie and I had apple pie and all my favorite foods and all my biscuits and rolls and all the good, pecan pie that I love.
Quite talking
Well,
about
again, sugar does it. Also, refined carbohydrates. All the whites, white bread, white rice, the pastries, the white flour, pasta, the biscuits, breakfast cereal bars, fruit juices, sodas, fruit smoothies, crackers and chips and French fries. That's all highly processed food. Now you say, well, why are these so bad? Because they spike your blood sugar and spike your insulin levels. And when you spike your blood sugar and insulin, it tells your body store belly fat. That is the number one cause of belly fat is simply too much sugar and refined carbs. Now, also another I've got to add is excessive carbohydrate intake. Carbohydrates are any wheat, corn, rice, bread, pasta, anything, even if it's unprocessed, it's high in carbohydrates. We eat too many carbohydrates. We eat between 45 and 65% of our caloric intake as carbohydrates. That programs us for weight gain. Now, you can do it when you're young, up to 18, but after 18, you've got to diminish your carbs to usually less than 10%.
Really? 18?
Yes. You can do it up to 18. Yeah, you can do it up to 18 because you're growing. You need the carbohydrates for growth. But after 18, you're not going to grow taller. You're going to grow wider. And so you're going to grow belly fat. So if you're eating all of these carbs, if you're eating 40 to 60% of your dietary intake is carbohydrates, you have just signed on the dotted line for belly fat and all the diseases that go with belly fat that I just mentioned. So it just goes with.
Can you lipo it out?
Most of that belly fat is underneath the muscle. Now, some is above, but again, many times the belly fat comes back, and it comes back worse. You can lipo some of it, but all that internalized fat, that is the toxic belly fat, your organs are bubble wrapped with that toxic fat. Then you'll grow more of that toxic fat. We're raising more, the blood pressure more, cholesterol more, triglycerides, more fatty liver. It's never ending. Here's what we need to do. We have to decrease our sugars, carbs, and starches, but especially refined carbohydrates. Brown rice or wild rice, most people choose white rice. Now listen to the carb content of rice. Take a half a cup of white rice. A half a cup contains 27 grams of carbohydrates. Take a half cup of wild rice. It contains just 16 grams of carbohydrates. That's 11 grams less. And so if you're going to eat rice, you say, what about brown rice? It has 23 grams of carbohydrates per half cup. So if you're going to eat rice, eat wild rice, but not a lot, just a little, like a quarter to maybe a half a cup. If you're eating a cup, you're getting way too much. You're getting 32 grams of carbs. And so I try and keep my carbs around 100 or less. Some people need to go down to 20 grams or less. Okay. Now, look at bread. You say, well, I eat sourdough bread. Well, sourdough bread has less gluten, but Ezekiel bread has more fiber and it's better for you. And it's not processed at all. So again, the Ezekiel bread's much better for you. It's a
healthier bread.
It's much healthier bread, and it has sprouted grains in them, which are healthier. And so instead of drinking orange juice, apple juice, grape juice, choose the whole fruits instead because it's got the fiber in it. Now, again, I wrote a lot about this in my book, Beyond Keto. I talk about the two healthiest diets in the world. Do you know what those diets are?
The Mediterranean.
The healthy Mediterranean. Right. Big difference in Mediterranean. Most Mediterranean has too many carbs in it. This is the healthy Mediterranean diet and the healthy keto diet or Keto Zone diet. So those are the two, in my opinion, the two healthiest diets in the world. If you have to lose weight, follow the healthy Keto Zone. If you want to stabilize your weight and keep your weight stable like what I do, I follow the healthy Mediterranean diet. Both are in here, and I go in detail on how to do it. Now, let's talk about other causes of belly fat. We talked about sugar, carbs, and starches. Stress.
I started to say cortisol.
Stress elevates
Yeah.
cortisol levels, and we live in very stressful times.
Boy.
And so the more stress you're under, the more cortisol you secrete. When you combine stress with sugars, carbs, and starches, which increases insulin and sugar, you have the dynamic duo of belly fat.
You know, I'm excited about the next 4 years.
Yes, it's going to be good years.
We have a great president now. We love Donald Trump. We're so excited. And we did our part to help get him in. And I just really believe he's right. We're headed into the golden age.
Absolutely.
And also for us as a people, faith people anyway, that we are going into a period that our stress, I really believe our stress is going to come down. And I believe we will see America become healthy
and prosperous
and
again.
prosperous again.
And less stress, less stressed again.
I really believe that this is our opportunity to thin down, slim down, get healthy.
And get healthy because we can just start some key things to reduce belly fat, reducing our stress.
Right.
And again, in everything, give thanks, for this is the will of God in Christ Jesus concerning you. So many people want to know the will of God. It tells us in 1 Thessalonians 5:18, in everything give thanks.
Right.
For this is the will of God in Christ Jesus concerning you. When you're in thanksgiving and gratitude, you decrease your cortisol levels. You decrease your stress. And that's why Psalms 34:1 says, I'll bless the Lord at all times. His praise shall continually be in my mouth.
Right.
And when we bless him at all times, we're in gratitude and we're attracting the goodness of God to us.
Right.
Like that song, The Goodness of God. I love that song. I listen to it almost every morning.
Stacey whining.
But that's...
My husband's listening to you every morning.
Well, I love that
song.
And it'll chase us like goodness and mercy shall follow you all the days of your life. That's 23rd Psalm.
Yes.
And when you're doing that, when you're in gratitude and thanksgiving and blessing the Lord, the goodness and gratitude follow you, and cortisol levels go down and belly fat goes down if you combine it with a low carb diet, no sugar diet. Okay.
Right.
So another key thing triggering belly fat is alcohol. And more Christians, due to their stress, are drinking a little wine at night, some a little more. They said, just have one glass. I see so many patients come in, women especially. I just have one glass of wine at night to settle down, calm my nerves so I can fall asleep.
You know, now they're going to put a warning label on the alcohol that it causes breast cancer.
It does.
Yeah.
But that little glass, I said, oh, you just have 4 ounces in there? 4 ounces? No, my glass is about 8 ounces. And so, again, you're right. So that much alcohol will increase the risk of breast cancer in women. So, but alcohol is associated with 7 different cancers, Mary. So when people start, calming their stress level down with alcohol, they're sowing seeds for cancer.
Right.
But also, alcohol triggers belly fat. It literally is like miracle grow for belly fat. That's why people who drink beer, spirits, wine, they get that big, pregnant-looking belly, even in men. And I was just talking with my brother yesterday. He said, I saw this guy, I see him every year, and he gets bigger and bigger. He's a musician. And he says, now he looks like he's carrying triplets.
Oh, my.
And he's just in his early 50s. And again, many times, it's just that alcohol. It really triggers belly fat, especially when combined with sugar. A lot of people are drinking the alcohol, these sweet dessert wines, or these margaritas with tons of sugar in it. It may calm their stress, but it's triggering more belly fat.
Right.
Now, another key thing that causes belly fat is lack of exercise. And so we got to start moving and doing it 5 days a week. You know that only 25% of Americans get adequate exercise?
Mm-hmm. I think it's higher than that. I really do. Except, let me just say this. Pickleball is bringing people back to working out more.
But only a quarter.
Increase of people my age anyway.
Well, most people don't get enough exercise. You know what they recommend? This is the physical activity guidelines for Americans. They recommend, at least for adults, 150 to 300 minutes of moderate intensity aerobic exercise a week. Now, if it's high intensity, you can get 75 minutes to 150 minutes. But I don't see people hardly ever doing high intensity exercise. So again, and they also recommend you do some weight bearing exercises at least twice a week of resistance training. Again, especially for women, it protects them from osteoporosis, especially those leg presses. Because so many women over 50, they start to lose their bones.
Yeah.
And when they lose bone, the main place it occurs is in their spine and in their hips and in their forearms. Then they're more prone to fractures. And so if you do leg presses, women, twice a week, 3 sets, 10 reps, guess what? It strengthens those bones. Those bones get stronger, and then take supplements. I've done programs on osteoporosis, osteopenia. But again, sedentary lifestyle is a major trigger of problems with obesity, belly fat.
Yeah,
And
God made us to move. He meant for us to move. So you got to get up and move, and you want to move regularly. You do. If you don't use it, you lose it.
exactly.
Yeah.
Now, the last thing is genetics. If your mother has morbid or class 3 obesity, your father has it, your aunts have it, your grandparents have it, your uncles have it, there's a good chance you're going to have it. And so some people, obesity runs in their family. There's a strong genetic component.
Right.
And so for these people, it's just they're going to have it. We got to follow the program.
Fight the fight.
And we have a key answer now, these GLP agonists, which are glucagon-like peptide agonists, which is an appetite it's an appetite hormone that literally suppresses your appetite. So many times these people only need 1 or 2 meals a day. And if you put them on either a healthy Mediterranean diet or a healthy Keto Zone diet, boom, they start to lose weight.
Wow.
And they keep it off too. We've had a lot of patients with that, and we're going to talk about those probably in the next show. I don't know if we're going to have enough time in this show.
What do you think about the shots that people are getting that?
And we're going to talk about that. I know that's part of
Well, tell them, what do you think of it?
Yeah, well, if you have morbid obesity, if you have a strong genetic component to your obesity, your mom has, your dad has it, you're maybe 25 and your BMI is 40, absolutely, you need to have it. Or if you have arthritis in your knees and your hips and your back and you can't exercise, you definitely want to get on that. Or if you're so fatigued, you have no energy to exercise, you kind of painted yourself in the corner, then absolutely look into these. We're going to be talking about,
because you want to get the weight bearing off your body and your.
Yes, because so many people are in wheelchairs that I see that come in my practice. They come in, they're 350 pounds. A woman, she's 5'3", 350 pounds, and she's got terrible arthritis in her knees and hips and back. She can't move. Yeah. She can't get out of her chair. She can't get out of the tub. She can't get off on the toilet. And so I said, the first thing, we got to get this weight off. And I'll put them on it immediately and get the weight off, and I'll drop 100 pounds off.
And the side effects, the possible side effects are minimal compared to
minuscule
compared to the weight.
Yes, but if you're not obese, if you're say class 1 obesity, you can do this with just our healthy Keto Zone diet and possibly the healthy Mediterranean diet. Yep. But if you have class 2 obesity or class 3 obesity, you need to look into these GLP agonists, which are the new meds we'll talk about on the next show.
Right. Okay.
But now the dangers, do we have time to talk about the dangers of obesity? We talked about some of them. We got a few more dangers to talk about. Now in men, if your waist measurement is 40 inches or greater, you're at a much greater risk of high heart disease, high blood pressure, stroke, and sleep apnea. Women, if your waist measurement is greater than 35 inches, you're also at a much greater risk of heart disease, hypertension, stroke, and sleep apnea. And again, realize the average woman's waist is around 7 inches. Men is 40.5 to 42 inches. So that's the average man. So that's why we're seeing an epidemic in heart disease, heart attacks, strokes, high blood. I see younger and younger men with strokes now because of the belly fat. It's the root cause.
Wow.
Now, in sleep apnea, again, sleep apnea is where the neck is usually 18 inches or above. Men go to sleep and their palate sags, and then they can't breathe, and then their pressure starts to go up. And so we're going to be talking more about these diseases associated with obesity. So if you have a big neck, and if you stop breathing at night or gasping for air, please get a sleep study. Or I see a lot of people with this. We recommend a special pillow that helps, or there's dental devices that help. So again, we know how to help this tremendously. And some people actually need a CPAP.
Yeah. Wow. Belly fat is
it's a killer, Mary.
Killer.
It's shortening so many people's lives. And again, we need everyone out there.
We can make a lot of jokes about things like this, but something that's really serious. It really is. And we just want to encourage you. If you're struggling in this area, we want to pray for you and pray that God will lead you and strengthen you and give you the will in order to do what you need to do to live for your family. Your family needs you. Your grandkids need you. Your kids need you to do what you need to do to
Amen.
take care of yourself. So be encouraged. God has answers to every disease, and He has the power of the Holy Spirit to give to you, to give you the ability to do what you need to do. We love you. God bless you.
We got answers on the next show.
Answers on the next show.